mix.
Mr. Lee, in my district, in the city of Atlanta, HIV infection rates are very concerning. From your testimony, it seemed that you have experience in reducing health care and insurance costs to consumers. What action or policies can make it easier for people, especially those living with HIV and AIDS, to access and afford the medication they need?
Yeah. Well, I think that one of the most important things the Affordable Care Act has done is change the rules of the game for insurance companies to not be about avoiding sick people, but now getting people who are sick the care they need when they need it. Part of what we've done in California is have, in our patient-centered benefit designs, limits on costs of high-cost specialty drugs, which are a major concern in terms of driving expense, but we want people that have to get specialty drugs to not have their copay be a barrier between them and getting those drugs. So we both require for people with HIV a mix of drugs at lower formulary tiers, but also for the most expensive drugs that may cost $60,000 a year, that a consumer would only have $250 a month they would need to spend for their share of the costs. And this is part of the balancing act we need to wrestle with as a nation, is we need to be addressing the rising costs of pharmaceuticals, the rising costs of specialty drugs, but let's not do that in ways that don't give life-saving drugs to consumers because of their high costs. And that's a balancing act we've struck in our patient-centered designs in California.
And Mr. Lee, I for one want to thank you for all your great and good work and for your vision in helping to provide health care, just not for the people of California, but for the people of our nation.
Thank you very much.
Back, Mr. Chairman.
Thank you, Dr.